Hi, everybody. Dr. MacKenna from Dara Wellness. We are here today with the big, easiest ways to wellness. And, I've had a lot of patients ask me about supplements because I'm an integrative physician. So, of course, I'm supposed to know about all these things. And it turns out, like when we did a little bit of research, about 77%, give or take, of Americans are on supplements. And I found out through some of my own learning that only about a quarter of those folks are telling their doctors, and about 75% of those folks are taking prescribed medications as well. So when you put all that together, I think we need an expert to come talk to us about supplements and help us choose wisely. And so with that, I have the amazing integrative and functional dietitian, Danielle Paciera. She's full of knowledge, and I'm super excited that you're here with us today. And I'm going to let you tell us a little bit about your background so folks can understand what you do, because I know people talk about dietitians, but sometimes I get a blank look when I ask my patients, have they seen one?
Well, you probably get a blank look for good reason, because I found early in my career, dietetics itself isn't very effective. So I began traditionally as an RD, but as I said, I didn't find that doing what I was trained to do as an RD was really helping people, making an impact in people's lives. So I started to look into natural and natural care, holistic health, complementary and alternative care, and decided to pursue some more formal training in that area, and have been doing organized education in that area since about 2004, I guess, in practice beyond the scope of many dietitians, and really embrace a lot more of the functional and integrative medicine type of approach. The reason that I am able to talk to you about supplements, however, is not just because of my experience. I had to learn a fair amount as an integrative practitioner, but I also have worked in the dietary supplement industry as somewhat of a medical science liaison, and also in the medical affairs department. So I know things from both the practitioner front, but also from the insider front.
Okay. Yeah. So how does that change your practice, do you think, having, your background and then also what you've been studying?
Well, it takes me a lot longer to do patient workups now that I'm doing them functionally. And I really feel like I'm able to help people in ways that I wasn't able to help them before. I started getting referrals for people from their physicians. The physicians would refer me essentially people that they didn't think that they were helping. They didn't know what to do with this person, so they'd refer them to me. And I can't say that it made a huge difference in everybody's life, but in a lot of them. And part of that is because I'm not looking at things from a diagnostic standpoint, i.e. diagnosing a disease, but I'm looking at things from a functional standpoint. So how well is your body functioning? And if you're here, it's probably not functioning well. So let's find out, what are those roadblocks? What's keeping you from feeling great, from your body having its full functional capacity? And I work on those more cellular levels to restore balance, so that whatever a person's trying to do, maybe they're trying to have less anxiety, maybe they're trying to lose weight, maybe they're trying to sleep better, maybe they're just trying to support their thyroid. Whatever they're trying to do, I can essentially take out some of the roadblocks, or help them take out some of the roadblocks, and more effectively accomplish those goals.
So that's really interesting. I love how you have mentioned several different types of folks, as far as things going on. And they didn't necessarily sound like, oh, I just don't know what to eat, like things like anxiety and various medical conditions. And that, the tendency in traditional medicine is to think, well, I just need to see a doctor and get a pill. But those of us who are in the integrative medicine world know that there's more to it, and kind of looking at what's causing the concern that's bringing folks in is often the better way of addressing it. And one thing people can control themselves without, a lot of outside influence, with some education, but beyond that is what they put in their bodies, right? So it sounds like you probably have a lot of conversations around that, depending on what's going on with the person.
A lot of people think dietitian, meal plan, dietitian, tell me what to eat. And while I love food and I love cooking, so I love to talk about it, but that's only one part of what I do. So oftentimes people will call me saying, "Oh, can you give me a meal plan for blah, blah, blah? Can you give me a month's worth of meals for blah, blah, blah?" And I tell them point blank, no, that's not what I do. Go to a regular dietitian for that, because what I do is much more comprehensive. But that being said, nutrition is a foundation. And if you don't have we started talking about supplements. If you don't have the foundation of good foods coming in, a clean lifestyle in general, then you can take all the pills you want, but you know what? They're not going to work the way you want them to work.
Yeah, absolutely. And so talking about the supplements, like how does your average person know what a good supplement is? Like how do you tell?
Well, it's really hard because there's a lot of stuff out there, and manufacturers are really smart at their marketing campaigns, I guess. And they make things sound really good. Oh my God, I need that, right?
Yeah.
Looking at what's on the label is important. The label can tell you a lot. Every manufacturer, a lot of physicians are under, and a lot of consumers too, under the misconception that it's just total Wild West, that supplements aren't regulated. And they are regulated. They're just regulated differently than pharmaceuticals. But they are regulated. That being said, it's a little bit of an honor system, and not every manufacturer is doing things with the utmost integrity. So not everything that's on the market is going to be worth the money. If you see a claim like, this is going to help you lose weight, this is going to boost your metabolism, it's going to help you burn fat, don't believe it. Number one, it's illegal to put those health claims unless it's a already approved health claim, which there aren't very many.
Yeah, because that makes it a medicine, right? Like that puts it in a whole different category of.
Indeed, it does.
Yeah.
If you make a health claim, that's what pharmaceuticals do, and that's illegal. So if you see a claim, you have to question, okay, if they're already putting illegal things on a label, what are they putting in the bottle? How are they going through how much care? Because if they're putting something on the bottle that makes that claim, that's an indicator to me that they're just out there to get in my wallet, that they're not really out there to help my health. Certainly looking at the unnecessary ingredients, that's another clue. If you look at a bottle and you see a long list of other ingredients, question it. Most supplements don't need to have a lot of other things in them. Yes, there's some things needed to help fill capsules or to act as a base for certain ingredients. Vitamin D is a good example. Vitamin D would be just a small, minute amount in a little capsule if it didn't have other ingredients in it. So there are things that are excipients that do things like give the supplement some bulk so that they fill the capsule. Some things that help dissolution, some things that help ingredients run over the manufacturing equipment better. But when you start to see a lot of those excipients, it can also be an indicator that manufacturers are just trying to pump it out. And if they're doing that, they're just taking essentially shortcuts. You should definitely see contact information. If you don't see contact information, you should question it, because the companies should be pretty transparent. And if they're not giving you their contact information, they're not going to be very transparent.
Oh, yeah, that's actually a really good point. That being able to, if you have a question, it should be easily answered. And, sometimes I don't know if it's because people get into that like traditional patient role of, back in the day, the doctor just told you what to do and you did it. Those of us who are, in our field don't operate that way. We're more in a partnership, but I think sometimes folks think they're not allowed to ask. Like they almost have lost any type of empowerment that they have as a patient or a client. And so I think that's a great point, that you really need to take control of that. It's what's going in your body.
And there are a lot of people who don't, but there are a fair amount of people that do. The last company with whom I worked, the customer service department just kept growing and growing. And one of my roles, was supporting the customer support team. Mm-hmm. And that role was growing and growing and growing because we had so many consumers. We had opened up from healthcare line only to the consumer market as well. And we were having so many consumers calling with so many questions. And I was helping them answer some of those questions when they couldn't answer them.
We actually have a question here.
Oh, that's great.
And it's for you. I love this, Miss Kim Paraloo. So she's asking if you're familiar with Consumer Lab, and if so, what you think about it, and as a reviewer of supplements, supplement ingredients and quality, and do you have other suggestions as far as regulators that we should be looking for?
I think that you should be the regulator. I think that knowing what to put in your body is more important than going with what Consumer Reports says. I do think some of what they say is good, but I also think that there's some financial investment involved in what they say. So I don't always think it's unbiased.
Oh, interesting. Okay. Because you've really seen it from both sides, right? Because you've been, on the manufacturing side, and now as someone who's advising folks who are using the products.
Indeed. Other things that will tell you if your supplement is a good one is what's in it aside from the other ingredients. What are the active ingredients? Are they using quality ones? You can take folate or you can take methylfolate. 60-something% of the US needs methylfolate because they have a genetic mutation, but there are tons of other things that affect the way that enzyme that makes you need that certain kind of folate run. That affects the way that enzyme runs, rather. And I would say, just guessing 80% based on what can affect that enzyme, 80% of the US population at the minimum probably needs methylfolate. Other things, there are B vitamins that are not very bioavailable, and there are some that really work in your body. There are certain kinds of minerals that your body can absorb in certain forms that aren't very absorbable because they decrease the acid needed to absorb them, which is kind of counterproductive. A perfect example is calcium carbonate. What do you find in a lot of the calcium candies? It's calcium carbonate, but that's one of the least bioavailable forms. And what bioavailable means essentially is that your body's going to digest, absorb, utilize, etc. A lot of those excipients and fillers can affect the dissolution and the absorption as well. And then herbs and botanicals brings up a whole nother thing. Some people will say, look only for standardized, but standardized refers only to extracts, and sometimes it's better to have a full plant ingredient, and sometimes it's better to have an extract, and sometimes it's better to have a combination of the two. So that you can't really say, but what you want to do is choose it from a company who's testing raw materials, who's storing them appropriately, who's not just testing the raw materials the first time they find them, but testing each and every batch of raw materials that comes into the manufacturing facility. And I'll tell you what, not even some of the best companies, let me rephrase that. Not even some of the companies that some healthcare providers think are the best companies are doing their due diligence in that regard. Then the manufacturing process, again, you can just try to shoot things through the manufacturing process using cheap fillers, or you can do it with integrity and use less fillers, but take a little bit more time and care and effort into putting these things into the capsule. And then testing is big. These supplements need to be tested before they hit the market so that the manufacturers are sure what is on the label is in the pill and no more. And they need to be sure that it's actually in the capsule in those amounts that are on the label. And one of the things that Consumer Reports has been helpful at doing is identifying that there are a fair amount of ingredients that are not contained in the label claimed specified amounts.
So is that Consumer Reports or Consumer Lab? Because it looks like she was asking.
Oh, yeah. It's, you know what? I think they've both done it, but.
Yeah. Because I know there are different, kind of looking at Consumer Lab and or Pro and some other places where you can see, what's available with each product. I mean, there's also, we're talking about testing the batches, but then depending on what the product is, seeing the shelf life of the product, with like probiotics.
Yeah, so looking for an expiration date is really important. Yeah. But I'll tell you, and I learned this from being inside the industry, not every product is going to have an expiration date, because to get an expiration, the product has to be put through testing to ensure that it's going to have the label claimed amounts at the end of that expiration date. So if it's a new product and the expiration date would normally be a 2-year expiration, but it's only been on the market for 6 months, it's not going to have an expiration date.
Oh, interesting.
Because that would be a lie. They don't know. Right. So then oftentimes you'll see a manufactured on date. If you see a company who only has manufactured on all of their bottles, it means that they're not testing to make sure that through a window of a year or 2 years or a year and a half, whatever, that their product is going to be able to maintain adequate levels. So, that's another thing to look at. Because it's a newer
product, or it could be just that they're not doing it. It's hard to know. I mean, you see that in traditional medicine as well. We look at the safety of certain medications. Newer medications appear to be safer, but that's because they haven't had the time to see what might come of taking them in the long term. So sometimes people go in thinking they have a sense of safety, that it's really just trusting the unknown, which sometimes is a good idea and sometimes is not. So that's really good to keep in mind.
I guess in terms of the Consumer Lab question, it's important to be your own judge and not only rely on one source to tell you if this company is a good company or that company is a good company, or a bad company rather. So no, in general, what I have found is that if you walk into a drugstore, you're typically going to find the lower quality ones, the ones that don't have very bioavailable nutrients. It takes a lot of financial investment to make a good supplement. So if something's really cheap, it's probably not worth your money. You might as well flush it down the toilet, as far as I'm concerned.
Yeah.
Don't go to Walmart to buy your supplements. Don't go to Target. Don't go to Walgreens. Don't go to CVS. The best supplements are typically going to come through a healthcare provider. Why? Not because they're making money out of it. Some of them forego all of the profits because they want to put quality supplements in the hands of their patients or their clients. But the reason why those tend to be better is because practitioners are going to be a little bit more knowledgeable in the bioavailable forms and in looking for things like all of those fillers. So their expectations on companies tend to be a little bit higher. They're also going to be more likely to pick up the phone and call the company and say, hey, I want to see your certificate of analysis for this CBD oil or this hemp oil you're putting in there. How often are you testing it? Are you testing for solvents, or are you just testing to make sure it has the specified amount of CBD and no THC? Those are really important things. And quite frankly, it's important for consumers to know if a company from whom they're purchasing their supplements is making them in a way that they're doing their due diligence and doing those tests. But in all likelihood, very few people are going to do that. So the healthcare practitioners typically will be the ones who are doing that. So essentially, they do the vetting that consumers would have to be doing.
Yeah, because there is, as I mentioned, 75% of folks who are on supplements are also on prescription medicines. And, just because it's natural doesn't mean it doesn't interact with other things that you're taking interact with each other or with your prescribed medication. So all the more reason that if you are taking a supplement, to talk to your doctor about it, or your healthcare provider, whomever that may be.
Super important.
Yeah, because they need to know, and if they don't know if they interact, there's ways to find out.
There's ways to find out, certainly. There are some online supplement checkers, but I think going through the practitioner is still really important because you may not need to be taking something. I see a lot of redundancy in people's supplements. Sometimes people take things at not the best time of day. Certain things shouldn't be taken together. Certain things are better on an empty stomach. Certain people need things in higher levels than what the recommended suggested serving, what have you, is on the bottle. So really it needs to be tailored to each individual. Certain supplements shouldn't be taken at the same time, i.e. at breakfast, as a certain medication, but they can be taken in the same day. And knowing someone who can help you sort out what to take when, and if you should be taking it, and how much you should be taking it, how you should be taking it, i.e. with food, without food, with water, without water. Don't take iron and fiber at the same time. Don't take iron with your coffee, perfect examples. So in terms, to summarize, look at the other ingredient list, throw it out if it has a lot of fillers. Look for bioavailable forms of nutrients. If you don't know what those are, talk to your healthcare provider. Come see me. I can help you with that. Certainly, Dr. MacKenna can help you with that. There are many others who are very knowledgeable in the area. Make sure that the company has the contact information, and make sure that you see an expiration date and no far-fetched claims on the label. If it sounds too good to be true, it is. And make sure your healthcare provider knows what you're taking. And if they're not knowledgeable in being able to guide you in your supplementation, then ask them for a referral to work with someone who is. I'm quite willing to work with anybody's physician, and I know some other functional nutritionists who feel exactly the same way. And not all dietitians are very well educated in supplements either. So you can't just go to any dietitian and expect that she's going to be able to guide you. You need to seek someone who has that expertise.
Yeah, and the level of comfort too to look at those things, because as we've said, these things do have regulations. They've also been studied. And when we're looking at, we've talked about what to look at on the label. Something that I've also mentioned to folks when they're just buying, they said, oh, I've been on valerian root, and it's usually like, a blend of 20 different things.
Mm-hmm.
Just to see how specific it is on the label. Like you mentioned, what part of the plant, does it say the whole plant? Does it say the flower? Does it say the root? What have you? And then also when we get into like the probiotics arena, we need it to say the specific types
CFU of that type. Mm-hmm.
Yeah, down to the numbers, because there are studies on these things. And when we look at those different probiotics, some have different indications. Some can help with things like depression and attention deficit and what have you, but we need it to be what the studies have looked at and not necessarily something we got off the shelf.
I'll tell you, if you see a patented ingredient, those patented ingredients typically are the ones that have been in clinical trials. So that's one thing that sometimes I'll look for. But, in all honesty, there's not a lot. Clinical trials are expensive. And there's not a lot of financial backing for the dietary supplement industry to go into these clinical trials. So you'll see that less commonly.
Yeah, absolutely. That's a great point for sure. Yeah, which all the more reason to, be talking to someone who maybe has experience and is more well-versed in how to use these things. So something that I know a lot of folks have been looking at and concerns about, and a lot of pop culture talking about, is using supplements and herbs and what have you for prevention or treatment of COVID-19. What are your thoughts on that?
There's a lot out there that actually have been shown to work on that. Let me think about how to say this in a more simple way. There are certain mechanisms that make the infection so deadly certain things that happen in the body that make it so deadly. And there are certain ingredients, not just supplements, but ingredients that have been researched to interfere with those mechanisms. So there are quite a few that can be helpful. The Institute of Functional Medicine is a great resource in that regard. They've created some really good handouts and guides. But there's a lot out there that may not be very effective against COVID-19. You know, we can't just say, oh, this helps with the flu virus, so it's going to help with this other virus. Some of these are very virus specific. Some of them are not virus specific because it's the way they're supporting the immune system. But I'll tell you what, right now, the lab testing analyses, the companies that test the raw materials, the companies that test the finished products, they're having trouble keeping up with the demand, because the demand, you know, we said 77% of people, or, you know, depending on what figure you're reading, it could be 84% are taking dietary supplements. It's grown since COVID. And there's not a figure because we haven't had a long enough time to come up with the study results to give us a figure, but it's grown so much that manufacturers were having trouble keeping up with the demand, as well as the testing companies, as well as the raw material ingredient suppliers. So I guess choose wisely. Things that generally support the immune system are going to be good, but it has to be, again, a quality form. Vitamin C is good, zinc is good, but it has to be a quality form, and it can't be taken by someone who would have a otherwise contraindication for taking those ingredients. I mean, this is just a whole nother topic.
So as far as general immune support, like we mentioned, vitamin C, you know, folks talk about like vitamin D as well. What other would you say, just for like general, if you're your average Joe, not on like 20 other pills that are prescribed?
You know, for some people maintaining good immune function, the mushroom blends can be good for supporting the immune system.
Yeah, Andrew loves those. He tells us about
curcumin, which is turmeric. Thank you. I blanked on the name. Turmeric. Quercetin is one that's been studied as well. Resveratrol has been studied. I don't have all of them in front of me right now, but the basics for supporting the immune system, I mean, you named it: vitamin C, zinc, vitamin D. Vitamin D is so important, but making sure that you're fed well. You know, if you're not eating well, you can take all the pills you want, and they're not going to do very much.
It all comes back to that, right? Like when we were having the other day, it all gets back to like what you're putting in your body originally. So that, you know, going towards those whole foods, you know, the less that's happening between it coming out of the ground and getting to your mouth, the better, right? It's, you know,
yeah. And part of what makes the infection become so deadly is the crazy high amounts of inflammation. And if you're not eating a clean diet, you're probably eating a more pro-inflammatory diet, and that's just going to set you up for problems if you do get an infection. Not to mention, it's not going to support your immune system very well to be able to fight off an infection. So, you know, starting with whole foods, real, fresh, vital foods, less things out of a package, things that come from a farmer, not a factory, things that look like they come out of the ground or off of the bush or out of the stream, you know, not things that
colorful, the better.
Right. Yeah. Rainbows in every meal, produce in every meal. Think produce and protein. That is one of the protein, produce, and fiber. Those things, if you have those as your go-tos, will generally steer you in the right direction. And seasonally too. It's important to think seasonally and locally.
Yeah, definitely support our local farmers. Can't say enough about them. Whatever we can do for that. But also, as you said, it's healthier. Like the less that's happening between the dirt and our mouths, the better. So local is the way to go when you can, for sure. And I mean, we could say that for those who eat meat for seafood as well. I mean, we're blessed to be on the coast and to have these wonderful folks who, you know, their lives are based on seafood. And a lot of the seafood that's coming out of the Gulf Coast has those nice omega-3s. So that's, you know, eating that a few times a week is also, you know, not only something that we love to do because we're New Orleanians, but good for you.
Oh, very important. I wouldn't even just say good for you, very important. But, you know, beyond that, we need to look beyond diet, beyond supplements, because if we're talking about supporting the immune system, what else is important? Stress management, sleep.
Yes. My favorite.
Yes. Those two things are make or break. You know, if you don't get your body essentially renews itself at night and rebuilds immune compounds at night. So if you're not getting that adequate sleep and that quality sleep, then you're not going to have the immune compounds that your body needs to fight this infection.
Absolutely. Can't say enough about that for sure. So, we were able to go to lunch together earlier in the week. And folks can we have a video of that's on YouTube, but also over on the Dar Wellness website. And when we were having lunch together, we were talking about ways to eat for controlling the stress and anxiety and the things that we're talking about. You know, here in our last moments, do you want to just give a shout out to some of the things that maybe folks can look at to eat to help with their stress management?
Yeah, you know, it's a common question I get is what food is good for stress? What food is good for mood? But it's not
the easy way. Give us the reason.
You know, we just want the quick fix. We just want the pill. But there's not really one food. You have to look at the bigger picture. And it's more of a combination of the foods you put together. You know, those omega-3s are going to be really important. A lot of those essential amino acids are really important. Getting enough B6, getting enough folate, natural folate, getting enough B12, getting enough niacin, riboflavin, calcium, iron, zinc, magnesium is huge, vitamin D is huge. So we want to make sure we have a very, very dense diet for those reasons. And unfortunately, there's not one food that's going to supply all of those nutrients. So where the rainbow comes in and the protein and the produce comes in, that's what gives you that nice blend of those necessary nutrients. So we went to eat poke, and poke has fish as a base. So that's going to give you those wonderful omega-3s. If you look at all the colors that you saw in our bowls, you can see that there's a lot of color. That's going to be a lot of potential anti-inflammatory, antioxidant compounds. Those are going to be very supportive to the immune system, but they're also very supportive to the brain and to the neurological system. Typically where you see the most color, you're going to find the most nutrients too. You saw avocados. Avocados are a great source of B6.
I love avocados.
I know, they're so good. There were macadamia nuts. Nuts and seeds are super saturated in vitamins and minerals. So they provide a lot of those minerals that we discussed. A lot of those green leafy vegetables that you may have seen in my bowl, those green leafy vegetables are a great source of magnesium. And that's a really important one too. I know it's been hot as hell. And if you look at us in that video, you can tell it's kind of really hot on the day we were eating. We were wilting flowers, yes. But getting that sunshine is super important because you want to, the best way to get your vitamin D level up is not through food. You just can't get a therapeutic dose of D through food. It needs to be through the sun. And it makes you happy too.
I know, right? So go out and garden, grow some food yourself. Like that's even the best way to eat some food.
Take a nap. Nap in the sun.
Yeah, oh, indeed.
But don't fall asleep for too long and get burned. It's bad for skin. Bad.
Or at least walk around the block and wave to your neighbors.
In your bathing suit, so you get a lot of skin exposure.
Yes. For sure. So, Miss Danielle, if folks want to come see you because they're intrigued, but also overwhelmed with the idea of trying to do this on their own, what's the best way to reach you?
calling is definitely one way, but I am also quite often not able to answer the phone because I'm talking to other people, with someone, with a client in an appointment, etc. So email is always good, and certainly you can find me via the web on my website. It's www.365vitality.com, and my email is my name with a lowercase d, so it's DANIELLE at 365vitality.com.
Awesome. Thank you so much.
This was so fun. I will do it as often as you need a person to fill in.
I love it. I love it. I love it. So again, guys, feel free to go check out us having lunch and having some fun and showing how you can go out to eat and still eat healthy and find things that are going to help your mood and help us with all our stress and all the wonderful things that comes with having lunch with an amazing, fabulous dietitian like Miss Paciera. So you can check that out on my website. You can also look on YouTube. Dara Wellness NOLA is my YouTube channel. Please subscribe. You'll get first look at any type of lanyard videos that I add that go onto my site later. And thanks so much to everybody for joining us. And I'll see you next week. I'll have Eric Kusin on to talk about mental well-being of all our athletes as we're going through COVID and all these transitions and what have you. So thanks so much, Danielle.
Thank you. This was great.